One of the most recent videos that I've done about pelvic examinations and being gentle and conducting gentle internal examinations as a gynecologist has gone so viral, and I've decided to talk more about pelvic examinations and walk you through this whole process. Hello everyone, this is Dr. Santoshi Nandigam, consultant obstetrician and gynecologist, the Birthwave Holistic Wellness Clinic, Nandigam, Chennai. Welcome to my YouTube channel. Now, what is this pelvic examination? Why is there so much apprehension and anxiety towards it? A gynecologist visit itself is filled with a lot of anxiety by many people, because of the whole concept of the pelvic examination and the fear and pain associated with it. Now, let's try and understand a couple of questions and bust certain myths related to pelvic examination. So the next time you visit a gynecologist, you're fairly confident, you know what exactly are you going through, and you'll be calm without any anxiety related to the pelvic examinations. Now, what is a pelvic examination? A pelvic examination is performed by a gynecologist under aseptic precautions, also called as a bimanual examination, where we insert 2 fingers or 1 finger or 2 fingers inside the vagina to assess or identify the size of the uterus, to feel the cervix, to see if there are any masses or any fibroids or anything that could potentially be present on the uterus, and to see if the mother has got any pain associated around the pelvic organs. Now, who needs this pelvic examination? Now, you may think that pelvic examination is only for people who have a problem, or who are pregnant, or who are associated or going through some menstrual disturbances. Honestly, it's not. Ideally, you should be starting your pelvic examinations from 21 years of age, which is also the age we recommend getting a pap smear done. Now, pap smear is for a different day. I'm going to talk in detail about it, and I'm going to talk in detail about the cervical cancer and cervical cancer vaccine as well. Coming back to the pelvic examination, every lady or a woman after 21 years should have regular pelvic examinations, whether or not they have certain issues or gynecological problems. Now, when is it done? So, try to schedule your gynecology visit or a pelvic examination after your periods or in between your periods. Most of the times, we may not advise to do a pelvic exam while you are on your period, because it may not give us any information unless you are going through a heavy menstrual flow. What can you expect in a pelvic examination? When you go to a gynecologist's office, obviously we're going to take your history, understand if you have a problem, whether your menstruation is normal, whether it's regular, or do you have any pain associated with your periods, or if you're someone who is sexually active, any associated symptoms or any pain during your sexual activity before or after sex, as well as spotting or bleeding after sex. Now, if you're someone who has any of these problems, the examination will be targeted towards identifying what could potentially be wrong. Now, if you're someone who has just gone for a regular gynecology checkup, looking at understanding the cervical cancer vaccine or taking cervical cancer vaccine or getting a pap smear done, we first collect the history. Then we put you in a lithotomy position. Lithotomy position is the traditional delivery position where you lie down on the bed with knees folded and legs spread apart. So it's a practice to ask you to empty your bladder or void or pass urine and then go to the examination, because when we do an examination in a full bladder, you may encounter a little bit of a lower abdomen pain. Now, once you are in the lithotomy position, we first use this instrument called as a speculum. The speculum can be of 2 different types. One is a Cusco's or a self-retaining speculum, and the other one is a Sims speculum where someone needs to hold it. Now, you must have seen the Cusco speculum quite a few times in my previous videos, and once the speculum is inserted, we are able to visualize the cervix. If you are taking a pap smear along with it or a HPV test along with it, we use the swab to smear out the cervix and send it to the lab for testing or examination of your cervical cells. Now, once the speculum is inserted, the cervix is visualized, we get to know if there are any lesions on the cervix, if there are any red spots, if there's any infection, if there's any white discharge, and we remove the speculum very gently. And then we do a bimanual examination or the pelvic examination using 2 hands, 1 or 2 fingers inserted in the vagina, mostly of the right, and the left hand on your lower abdomen to assess the size of your uterus. Most of the times, if you have a normal size uterus or an abnormal size uterus, we should be able to identify the size and give it in terms of weeks of gestation. That is the comparison that we usually give. So someone who has a normal size uterus, the uterus is located deep inside the pelvis. We may not even be able to see or palpate on the abdomen. If you're someone who is pregnant, or if you're someone who has fibroids, or if you are someone who has adenomyosis where the uterus size is bigger than the usual, it may or may not be a pelvic organ, and we will be able to determine the size of the uterus. And we mention it as a corresponding to 8 weeks, corresponding to 10 weeks, corresponding to 12 weeks. Even though you are not pregnant, that is a size comparison we use to write or assess on your case sheet. Once the bimanual pelvic examination is done, we ask a few questions, whether it is hurting as we move our fingers inside your vagina. Then comes another examination called as a rectovaginal examination, where we also insert a finger in your motion passage if you are someone who has complaints of really bad painful periods, or if there's a suspicion of endometriosis. Now, this is grossly what a pelvic examination is and what you can expect out of the whole gynecology checkup.
Ma'am, does pelvic examination hurt?
Okay, so pain is a very subjective feeling, and if you ask me as a gynecologist and also as a woman who has been through on and off pelvic examinations, I would say that I also had apprehension and anxiety when I went through a pelvic examination, but it is not painful, it is a bit uncomfortable.
Is it only for married women?
Absolutely not. Pelvic examination can be for women whether they are married or not married, whether they are sexually active or not sexually active. If they have any issues associated with their periods, or there's an infection that they are experiencing, so it does not have to be married or unmarried.
Does it take away my virginity?
No, it does not take away virginity. This is one of the most commonly asked questions, that if I as a gynecologist do a pelvic examination for someone who is not being sexually active, is it going to remove her virginity, or is it going to tear her hymen? No, it does not work that way. It does not remove one's virginity.
Do male gynecologists perform pelvic examination?
Yes, of course. Male gynecologists are as much as well trained as female gynecologists, because they are gynecologists at the end of the day, and yes, they do perform pelvic examinations as well. So I would want to close this video off talking about what all you can do to calm yourself down, or some tips towards an easy pelvic examination. So always plan your pelvic examinations or gynec visits probably after your periods, where you are not very tender. When you are premenstrual, you may be slightly tender, or there's a lot of blood circulation towards the pelvic organs. You may be a little hypersensitive. So immediately after your periods, you are much better. So plan it around your 48 to 56 hours, 48 hours after your periods. When you are with your gynecologist and are asked to go onto a lithotomy position, try to keep your legs a little apart and breathe in through your nose, out through your mouth. Try to consciously deviate your mind on your breath, because that actually makes it very, very easy. And try to relax your pelvic floor and put your bottom or the buttocks on the table, because when you try to lift up your buttocks, it kind of contracts your pelvic floor musculature as well, and the examination gets difficult. The whole process hardly takes about 1 or 2 minutes, that's all. So it's not something which goes on for about minutes or even hours together. So it's just a couple of minutes, the 1 or 2 minutes of you consciously trying to breathe and relaxing your pelvic floor, and the gynecologist should be quick in and quick out.